workforce safety and wellness. Introduction. Work as an emergency responder carries with it a level of increased risk compared to other professions. Emergency medical technicians often work under demanding, strenuous, and rapidly changing circumstances. As part of their work, emergency medical technicians may be exposed to infectious disease, occupational injury, physical violence, and more. They may be called on to respond to scenes of sudden tragedy and violence, and during the course of caring for others, they themselves may suffer physical, mental, or emotional harm. Recent years have brought an improved understanding of the threats and stressors that affect emergency medical technicians, including sleep deprivation, physical violence, compassion fatigue, post-traumatic stress disorder, and responder suicide. Recent studies have found that 84% of first responders have experienced traumatic events on the job, and that 34% have received a formal diagnosis of a mental health disorder such as depression or post-traumatic stress disorder. Moreover, the rate among emergency medical technicians and paramedics of either contemplating or committing suicide is far higher than the rate among other adult Americans. Although such concerns for emergency medical service providers have always existed, they are now being discussed more openly. As an emergency medical technician, you must care for yourself, not just physically, but also mentally and emotionally, before you can expect to care for your patients. As part of your training, you will learn how to recognize threats to your health, safety, and well-being and that of your partners and your patients. You will also learn how, when possible, you can avoid such hazards, protect yourself and others from them, or minimize their effect. Finally, you will learn how best to manage the mental, physical, and emotional health conditions that result from operating in emergency environments and caring for the sick and injured. General health, wellness, and resilience. Although most people might think of health simply as the absence of disease or physical injury, we now understand that health is a complex interaction between physical, mental, and emotional conditions. Because they're intertwined, chronic physical, mental, or emotional stresses can worsen or increase the chances of developing combinations of physical, mental, or emotional health conditions. Fortunately, the opposite is also true. Supporting good physical, mental, and emotional health can significantly lower the risk of chronic and acute health problems. Wellness and stress management. In daily life we often use the word stress to describe difficult, harmful, or negative conditions. In fact, not all reactions to stress are negative. A stressor that produces a positive response is called eustress. One example might be a dispatch to a high-speed motor vehicle collision. Characteristics of eustress following such a dispatch may include increased focus, energy in the short term, and, in the long term, increased job satisfaction and self-image from performing well under a challenging situation. In contrast, distress is stress that produces negative responses. For example, the same motor vehicle collision may result in short-term feelings of being overwhelmed, increased anxiety, and loss of focus, along with numerous long-term psychological and physiologic difficulties. Strategies for wellness and resilience. Understanding how stress affects you physically, mentally, and emotionally can help you manage the effects of distress. Stress may be experienced in the short term as a single, isolated event, or it may be a chronic or long-term issue. Likewise, how a person responds to a stressor can depend greatly on factors such as the person's overall mood, health, and other sources of stress that may be present at the same time. Because so many factors come into play, different people will react differently to the same stressors. Moreover, a person may react differently to the same stressor under different circumstances. While one emergency medical technician may not be adversely affected by the stress of a difficult emergency call, his or her partner on the same call may experience serious after effects. Also, although an emergency medical technician may be able to handle a certain amount of stress one day, he or she may not have the capacity to handle that much stress on another day or in other circumstances. A significant challenge is that one source of distress can often lead to another. An emergency medical technician experiencing personal issues at home may become more sensitive to stressors at work. The troubles at work can, in turn, lead to more distress at home, leading to a vicious cycle that can be difficult to break. A key goal of workforce safety and wellness is to set yourself up for success by creating conditions that can help you better deal with stress in both the short term and the long term. Wellness is the active pursuit of a state of good health. It is crucial for emergency medical service providers to understand that they must work to maintain their wellness in the same way that they must work to maintain their knowledge, skills, and attitudes to be effective emergency responders. Wellness is multifaceted. Maintaining good physical fitness is important, but by itself it is not enough to ensure wellness for an emergency medical service provider. Resilience is the capacity of an individual to cope with and recover from distress. Although some people tend to be more resilient than others, a person's resilience may change. The following practices can help increase resilience. Eat a healthy and well-balanced diet. Ensure a minimum of 7 to 9 hours of sleep per day. Strengthen positive relationships with close family and friends. Build relationships with peers and colleagues. Incorporate daily stretching, movement, and exercise. Build habits of mindfulness and positivity. The term stress management refers to the tactics that have been shown to alleviate or eliminate stress reactions. A clue to the management of stress comes from the fact that it is not the event itself but the individual's reaction to it that determines how much it will strain the body's resources. The following sections provide some suggestions for how to prevent the effects of stress from adversely affecting you. Nutrition. As an emergency medical technician, you have little control over what stressors you will face on the job on any given day. Consequently, stress in one form or another is an unavoidable part of your life. Just as you would study for a test, dress properly for a day of snow skiing, or train for a sporting event, you should physically prepare your body for stress. Physical conditioning and proper nutrition are the two variables over which you have control. Muscles and bones will weaken without sufficient activity. Regular, well-balanced meals are essential to provide the nutrients that are necessary to keep your body fueled. Vitamin-mineral preparations that provide a balanced mix of all the nutrients may be necessary to supplement a less than perfectly balanced diet. The physical exertion and stress that are a part of your job require a high energy output. If you do not have a ready source of fuel, your performance may be less than satisfactory. This can be dangerous for you, your partner, and your patients. Therefore, it is important for you to understand and follow the guidelines of good nutrition. In general, you should limit your total consumption of sugar, fats, sodium, and alcohol. These foods are quickly absorbed and converted to fuel by the body. However, simple sugars also stimulate the body's production of insulin, which reduces blood glucose levels. For some people, eating a lot of sugar can actually result in lower energy levels. Complex carbohydrates are comparable to simple sugars in their ability to produce energy. Complex carbohydrates such as pasta, rice, and vegetables are among the safest, most reliable sources for long-term energy production. However, some carbohydrates take hours to be converted into usable body fuel. The proteins in meat, fish, chicken, beans, and cheese can also take several hours to convert to energy. Fats are also easily converted to energy, but eating too much fats, or eating the wrong fats, can lead to obesity, cardiac disease, and other long-term health problems. Consumption of fats should be limited to 10% of calories, and should focus on monounsaturated and polyunsaturated fats while avoiding saturated fats or trans fats. It is also important to limit cholesterol intake and salt, sodium, intake. Carry an individual supply of your own high-energy food to help you maintain your energy levels. Eating several small, healthy meals throughout the day can keep your energy resources at constant high levels, and help you cope with the stresses inherent in emergency medical service work. However, overeating may reduce your physical and mental performance. After a large meal, the blood that is needed for the digestive process is not available for other activities. You must also maintain an adequate fluid intake. Hydration is important for proper functioning. Fluids can be easily replenished by drinking any non-alcoholic, Caffeine-free fluid. Water is generally the best fluid available because the body absorbs it faster than any other fluid. Avoid fluids that contain high levels of sugar. These can actually slow the rate of fluid absorption by the body and cause abdominal discomfort. One indication of adequate hydration is frequent urination. Infrequent urination or urine that has a deep yellow color indicates dehydration. Exercise and relaxation. Regular exercise will enhance the benefits of maintaining good nutrition and adequate hydration. When you are in good physical condition, you can handle job stress more easily. Regular exercise will increase your strength and endurance. To maintain good health, you should engage in at least 30 minutes of physical activity at least 5 days per week. Exercise should be moderate or vigorous to have good health benefits. In other words, you should break a sweat. Your exercise routine should involve aspects of cardiovascular endurance, muscular strength building, and muscle flexibility. Endurance will ensure your cardiovascular system is able to provide your muscles and brain with needed oxygen. Strength and flexibility building ensures the body is able to handle the requirements that you will place on it by lifting patients, performing cardiopulmonary resuscitation, and moving heavy equipment. Remember, if you do not use it, you will lose it. Plan activities ahead of time and use strategies that make your exercise sessions convenient. Is there a gym or exercise facility near your home or on your route to work? Is there a walking path or a running track? Where possible, join or gather a group of other people to exercise with you. This can increase your chances of exercising consistently, increase your enjoyment of exercising, and build enjoyable social relationships, which can also increase your resilience. Safe lifting practices. We have already discussed the physical requirements of being an emergency medical technician. Lifting 125 pounds, 57 kilograms, can be difficult if you do not exercise regularly. Lifting is one of the things you will do often, so safe lifting techniques are critical to your health and well-being. Back injuries are common in emergency medical service work. Chapter 8, Lifting and Moving Patients, discusses good techniques for lifting and moving that can decrease your risk of injury. For your health and well-being, remember these tips. Pre-plan the move. Bend your legs, not your waist. Keep the weight close to your body. Lift straight up, using your legs, not your back. Sleep. Because of the nature of shift work, and the intensity and around-the-clock nature of emergency medical care, many emergency medical service practitioners find themselves chronically fatigued and experiencing sleep deprivation issues. The National Sleep Foundation and the American Academy of Sleep Medicine recommend that adults sleep a minimum of 7 to 9 hours per night. Research has found that half of emergency medical service personnel get less than 6 hours of sleep per 24 hours and report severe mental and physical fatigue. In the short term, such fatigue can lead to medical errors, vehicle crashes, and other harm to patients, bystanders, and emergency medical service providers. In the long term, such sleep deprivation can lead to hypertension, sleep apnea, respiratory issues, diabetes, depression, and other medical conditions. Sleep deprivation and fatigue issues can increase stress, and, in turn, increased stress can contribute to sleep deprivation and fatigue issues. These problems may be compounded in emergency medical service systems where workload is particularly high. Evidence-based guidelines for fatigue management have been developed under the United States Department of Transportation through the National Association of State Emergency Medical Service Officials. They include the following recommendations. Fatigue or sleepiness survey instruments should be used to measure and monitor fatigue among emergency medical service personnel. Emergency medical service personnel should work shifts shorter than 24 hours in duration. Emergency medical service personnel should have access to caffeine to help stave off fatigue. Emergency medical service personnel should have the opportunity to nap while on duty to mitigate fatigue. Emergency medical service personnel should receive education and training to mitigate fatigue and fatigue-related risks. Recommendations for individual providers to combat fatigue include the following. Get an adequate duration, more than 7 hours, and quality of sleep. Where allowed, take 20 to 30-minute naps or rest breaks during shift work. Increase physical exercise such as stretching, walking, and jogging in place. Be careful about caffeine consumption. Caffeine can increase alertness but is not a replacement for sleep, and in large quantities can contribute to cardiac dysrhythmias, seizures, and increased stress and anxiety. Engage in mental exercise, such as having a conversation or playing a game. Of course, the most effective way to combat fatigue is to ensure good sleep in the first place. Productive sleep is as important as eating well and exercise in the maintenance of good health. Sleep should be regular and uninterrupted. Recommendations to improve sleep quality include the following. Avoid caffeine, alcohol, nicotine, and other chemicals that interfere with sleep for at least 4 hours before bedtime. Ensure your sleep environment is dark, quiet, and cool. If necessary, use blackout shades or an eye mask to block light, or earplugs or devices that produce white noise to reduce noise. Exercise early, but with enough time to relax before you try to fall asleep. If you nap, nap early. Avoid naps before your regular sleep. Avoid heavy pre-sleep meals. Balance fluid intake. Stay hydrated, but avoid overhydration. You don't want your sleep to be interrupted by trips to the bathroom. Establish a calming pre-sleep routine. This could include taking a bath, reading a book, or practicing meditation or relaxation exercises. Sleep when truly tired. If not asleep after approximately 20 minutes, try additional calming pre-sleep activities rather than fighting to get to sleep. Don't watch the clock before bed or if you wake up in the middle of your sleep cycle. Keep your sleep schedule as consistent as possible. Where possible, expose yourself to natural light during your waking hours to maintain healthy sleep-wake cycles. Disease prevention and health promotion. Another aspect of wellness involves disease prevention and health promotion. Strictly speaking, although both of these efforts involve personal practices and medical services, disease prevention focuses more on medical care and prevention to avoid or reduce the effect of disease on an individual. Health promotion is more focused on personal practices and social habits to improve one's health. Examples of disease prevention include preventive and post-exposure vaccinations, dental hygiene services, disease screening, and education and counseling relating to physical, mental, and emotional health risks. Examples of health promotion include education about and support for proper diet and nutrition, physical exercise, tobacco and vaping cessation, and use of mental health and substance abuse services. Smoking, vaping, or chewing nicotine. If you don't already use tobacco or vape, don't start. Use of tobacco products produces many of the most horrible cardiovascular and lung disasters that you will confront during your career. Use of smokeless tobacco, dry or moist snuff, is associated with cancers of the throat, mouth, and pancreas. Vaping has been shown to produce significant negative effects on the cardiovascular and respiratory systems. It has been cited as the cause of death for dozens of users, from a condition termed e-cigarette, or vaping product, use-associated lung injury. When trying to quit using products containing nicotine, several strategies may help, including the following. Create a plan that addresses the challenges that may trigger you to smoke, chew, or vape. Set a quit date, preferably within 2 weeks of setting your plan. Tell friends, family, and coworkers your plan to quit. Remove tobacco and vaping products from your home, car, and work, and, where possible, avoid places where they may be present. Talk to your doctor about other resources that may be available to help you quit. Alcohol abuse. Acceptable alcohol consumption is described to be 1 drink per day for women, and 2 drinks per day for men. Definitions of excessive drinking are shown in Table 2-3. In most cases, people who drink excessively are not necessarily alcoholics or have a diagnosis of alcohol substance use disorder. However, they may still experience adverse effects. According to the Centers for Disease Control and Prevention, Excessive alcohol use causes approximately 88,000 deaths per year in the United States with an economic cost of more than $200 billion per year. Approximately 75% of the total cost of alcohol abuse is attributed to binge drinking. Some studies have touted the health benefits related to moderate consumption of alcohol, such as improved heart health from drinking red wine. The Centers for Disease Control notes that no one should start drinking or drink more frequently based on potential reported health benefits. Although these benefits may exist, increased alcohol use may adversely affect other body systems, including the cardiovascular, hepatic, immune, and central nervous systems. Excessive alcohol use may also increase the risk of the development of various cancers, including those of the mouth, throat, breast, esophagus, and liver. Drug use. Both prescription medications, and illegal, or illicit, drugs may be abused or misused. Both are potentially dangerous and may lead to numerous additional health problems. According to the Centers for Disease Control, drug abuse costs the United States more than $190 billion annually in lost work productivity, health care, and crime. Illicit drug use is both illegal and unhealthy, typically resulting in a snowball effect of bad outcomes. Many emergency medical service agencies drug test their employees. Those who test positive for illegal drugs, or even for prescription drugs when a bona fide medical use cannot be verified by a physician, face suspension and/or dismissal. Therefore, avoid all illegal drugs, take only those drugs prescribed for you personally by a physician, and take them only as directed. In certain cases, even a drug prescribed by a physician should not be taken if the emergency medical technician plans to work. The benefits of the drug versus the chance that its effects could impair the performance and safety of the emergency medical technician, the crew, the patient, and the public must always be considered. If any type of restricted, scheduled, or narcotic drug is prescribed, usually while you are off duty, be sure to notify your employer of the situation. Balancing work, family, and health. As an emergency medical technician, you will often be called to assist the sick and injured at any time of the day or night. Unfortunately, there is no way to predict the timing of illness, injury, or interfacility transfer. Volunteer emergency medical technicians may often be called away from family or friends during social activities. Shift workers may be required to be apart from loved ones for long periods of time. You should never let the job interfere excessively with your own needs. Find a balance between work and family. You owe it to yourself and to your family. It is important to make sure you have the time that you need to relax with family and friends. It is also important to realize that co-workers, family, and friends often may not understand the stress caused by responding to emergency medical service calls. As a result of a bad call, you might not feel like going out to a movie or attending a planned family event. In these situations, help from a formal peer support group or critical incident stress management team, or information sessions conducted by your emergency medical service unit's employee assistance program, may assist you in resolving these issues. When possible, rotate your schedule to give yourself time off. If your emergency medical service system allows you to move from station to station, rotate to reduce or vary your call volume. Take vacations to lower stress and improve your physical health so you will be able to better respond the next time you are needed. If at any point you feel the stress of work is more than you can handle, seek help. You may want to discuss your stress informally with your family or coworkers. Help from more experienced team members can be invaluable. You may also want to get help from peer counselors or other professionals. Seeking help does not make you weak in the eyes of others. Rather, it shows that you are in control of your life. Infectious and communicable diseases. As an emergency medical technician, you will be called on to treat and transport patients with a variety of infectious or communicable diseases. An infectious disease is a medical condition caused by the growth and spread of harmful organisms within the body. A communicable disease is a disease that can be spread from one person or species to another. Immunizations, simple hand washing, and other protective techniques can dramatically reduce the healthcare provider's risk of infection. Familiarize yourself with the following terminology related to infectious diseases. A pathogen is a microorganism that is capable of causing disease in a susceptible host. Contamination is the presence of pathogens or foreign bodies on or in objects such as dressings, water, food, needles, wounds, or a patient's body. Exposure is a situation in which a person has had contact with blood, body fluids, tissues, or airborne particles in a manner that may allow disease transmission to occur. Personal protective equipment is protective equipment that an individual wears to prevent exposure to a pathogen or other hazardous condition. Routes of transmission. Whereas all infections result from an abnormal invasion of body spaces and tissues by germs, different germs use different means of attack, or mechanisms of transmission. Transmission is the way an infectious disease is spread. There are several ways infectious diseases can be transmitted: contact, direct or indirect, aerosolized, in droplets, foodborne, and vector-borne, transmitted through insects or parasitic worms. Contact transmission is the movement of an organism from one person to another through physical touch. There are two types of contact transmission, direct and indirect. Direct contact occurs when an organism is moved from one person to another through touching without any intermediary. The scenario of a vehicle crash can help you understand how transmission occurs through direct contact. The driver of the vehicle has hepatitis B and is bleeding uncontrollably from an arm injury. The emergency medical technician caring for the patient will need to make contact with the blood to control the patient's bleeding. The emergency medical technician has a small unnoticed cut on her own arm, and accidentally makes direct contact between the patient's bleeding arm and her own cut arm. As she touches the patient, the hepatitis B virus moves from the victim's blood into the emergency medical technician's body through the cut on her arm, thus infecting her. This is an example of direct contact, where blood is the vehicle. Bloodborne pathogens are microorganisms that are present in human blood, and can cause disease in humans. Another example of direct contact is sexual transmission. Patients who are infected with the human immunodeficiency virus can transfer the virus to their partners during sexual intercourse. Indirect contact involves the spread of infection from the patient with an infection to another person through an inanimate object. The object that transmits the infection is called a fomite. Using the same patient from the previous example, as the emergency medical technician was caring for the patient, some blood got onto the ambulance stretcher. If the stretcher is not properly cleaned afterward, the virus remains on the stretcher, and can be transmitted to someone else days later. Needle sticks are another example of how infection spreads through indirect contact. In this case, the virus moves from the patient to the needle to the healthcare provider. This route of transmission was more common many years ago before the advent of safety equipment such as needleless intravenous systems. Airborne transmission involves spreading an infectious agent through mechanisms such as droplets or dust. The common cold is caused by a type of virus called coronavirus that moves from person to person by coughing and sneezing. Interestingly, when a person sneezes, the moisture from the airway moves forcefully and quickly through a narrow opening. If the moisture droplets are large, they travel short distances, and can be involved in direct contact transmission. If the moisture droplets are tiny, they are turned into an airborne particle, and can float in the air for long distances. Sneezing can actually transmit disease through direct contact and airborne routes. When the virus lands on a surface, it can survive for some period of time. If someone touches the surface, and then touches his or her face or mouth, infection can also occur via indirect contact. A type of coronavirus known as SARS-CoV-2 is responsible for the disease known as COVID-19. Its transmission is via the same routes as the coronavirus that causes the common cold. Because of airborne transmission, it is unsanitary to use your hands to cover a cough or sneeze because the organisms travel onto your hands. If you then touch a cell phone, doorknob, or a patient, the organisms will travel. Using a tissue when coughing or sneezing is better for controlling the spread of organisms, but you then have a piece of paper full of organisms. One of the best techniques to avoid contaminating your hands is to cough or sneeze into your arm. Because you do not touch objects with your inner arms, the risk of moving or